Welcome to Chapter 18, Nutrition During Pregnancy and Breastfeeding. This is such an important time both for mom and baby. And so nutrition is really, really important and can have lifelong impacts for baby. Obviously, mom's nutrition is going to affect baby. This is true before baby is even conceived. So mom's preconception nutrition can actually alter baby's outcome and baby's health, as well as baby's growth in the womb. Nutritional status of the father as well can affect this scenario, as well as the couple's ability to even be able to conceive. And more they're learning that specifically obesity in either mom or dad can affect ability to conceive a child. Fat, carbohydrate status, antioxidant status, B vitamins, especially for mom. Zinc is especially important for men, and iron is important for both genders to be able to conceive a child. And all of these nutrients are necessary for a woman to have normal menstrual cycles and then carry that child to term. So body fat. So what happens when there is excess fat is those adipose cells actually produce hormones, and they can produce estrogen, which is normally a hormone produced by our reproductive glands, our reproductive system. If you don't have a lot of body fat, you will not produce very much estrogen, and this can cause fertility to be impaired. If a man does not have enough body fat, they're going to have lower sex drive and low sperm count and can actually become, infertile is not the word, but yeah, infertile, not being able to produce children. BMI greater of 20 is associated with the best reproductive health, but only up to a point. Obviously, a BMI of something like 40 would not be good. And specifically because excess fat can cause extra estrogen production, and this can throw off the menstrual cycle. For men, it actually leads to reduced sex hormone production, so decreased testosterone and decreased sperm count. And one of the reasons is men who are obese tend to have more fat insulating them and potentially have higher body temperatures in their testes, which can cause damage and death of the sperm. So if somebody is overweight or obese, losing just a little bit of that weight can help them increase their chances for conception. Folate. So hopefully you guys remember that folate is a B vitamin, and it is involved in DNA and RNA synthesis, so it's absolutely crucial for life. It's needed to form an egg and a sperm, as well as the baby, and some of the sources are green leafy veggies, strawberries, orange juice, ready-to-eat breakfast cereals. Many breads have folate in it, whole grains have folate in it, and there's also synthetic forms of folate that can be taken as supplements. Antioxidants. So there's always risk for oxidative damage, and free radicals can damage either the egg or the sperm cells. This is especially important for the egg because when a woman is born, she has all of the eggs that she is ever going to have. And so with age, oxidative damage can actually build up, and those eggs can, in a sense, be less healthy. So having a diet that's rich in antioxidants can be one kind of weapon against some of this oxidative damage. We know we can get antioxidants from brightly colored fruits and veggies, so maybe red bell peppers, yellow bell peppers, strawberries, cantaloupe, carrots, kale, spinach, red cabbage, berries, all sorts of different things like that. Vitamin E is also a very strong antioxidant, and so foods that are high in vitamin E, such as plant oils, are also great sources for just improving fertility and reproduction. Additional nutrients. Iron is needed for formation of our red blood cells, as well as many other factors. Without it, we cannot carry oxygen. If somebody is severely anemic, their menstrual cycle can be affected. There's also iron loss during the menstrual cycle, so women has higher needs for iron to replace those losses. Zinc, we discussed male fertility a little bit, but specifically zinc helps protect sperm from oxidative damage. Dietary fat, you want to focus on the healthy fats versus the not so healthy fats. Saturated and trans fats have been associated with impaired ovulation or poor sperm quality. And alcohol is kind of a questionable one. There's no doubt that alcohol is bad for the developing fetus. Most studies say it does reduce fertility. However, not every single study out there says that. So there's a little bit of a question mark, but if a woman has a chance to get pregnant, better that she just abstain or severely reduce her alcohol consumption during that time. Okay, so some of the prenatal development, what is actually happening. So length of a normal pregnancy is 38 to 42 weeks, and it's divided into periods called trimesters. One thing that happens during a normal pregnancy is the woman actually grows a brand new organ, and she grows this organ inside her uterus, and this organ is called the placenta. And the placenta is an organ that forms to accommodate fetal growth and supply the fetus oxygen and nutrients it needs. And it does so through the umbilical cord. So many of you guys are probably familiar with this type of a concept. This is a chart showing different stages in a woman's pregnancy as well as stages in fetal development, and it does have it broken down into preconception as well as trimesters. So preconception would be when the egg is in the uterus and sperm is meeting the egg. Once conception occurs, the cells will start rapidly dividing. In the first trimester, already by the 4th week, many very, very important organelles have formed. You can see by the 2nd and 3rd trimesters, this really looks like a small human, and little things like the ear canals and things like that are beginning to be developed. At the top, I like this part. It's kind of scary, but I do like it. Risk from toxic agents. So in these first few weeks, risk week 1 to, right around week 3, there's not too much risk of actually toxicities harming this developing fetus because not much has happened. It's just a bunch of cells. However, starting around week 3, which may or may not be when a woman finds out she's pregnant, there is very, very, very high risk of structural abnormalities. And then starting in the 2nd and 3rd trimester, physiological defects. So like I mentioned, this first trimester is absolutely crucial. This is a time where the cells are dividing rapidly and the very, very important organs are forming. So the central nervous system, the brain, the kidneys, the liver, the spinal cord, the spleen, the intestinal tract, etc., the lungs, the heart. And so specifically during this time, any sort of exposure to toxins, whether environmental or perhaps found in food or taken as a medication or recreational medication, can have severe, long-lasting effects on that fetus, and in some cases can even lead to miscarriage or spontaneous abortion. And it is actually estimated that many women actually do miscarry before they even know that they're pregnant. So that's actually a pretty common circumstance to happen. In the first trimester, there is no need for mom to increase calories, and that's because her nutritional needs are not that significant compared to when she was not pregnant. However, the 2nd and 3rd trimesters are quite different. So the 2nd trimester, you have already had development of the major organs as well as the majority of kind of the skeletal system. And now I guess you could say you're making the details, filling in the details. So the ears, the teeth, the jawbone are formed, and the baby definitely looks like a baby. You could even observe babies in the 2nd trimester sucking their thumbs. You can hear their heartbeat. They're really starting to become a very little human. This is a time of many maternal changes, and this growth in breast tissue is just one of many of them. But mom's breasts will significantly enlarge, and this is to prepare her for breastfeeding and lactation. 3rd trimester, the baby significantly gains weight and a lot of important nutrient transfer occurs. So baby might start off at around 2 or 3 pounds and end up anywhere between 5 and 9 pounds in best case scenarios. It is obviously possible for babies to be bigger and smaller, and we'll talk about that coming up. This is the stage where there is nutrient transfer to baby. So hopefully mom has stored plenty of nutrients, fat-soluble vitamins, fat stores for herself, etc. And some of those nutrients can start to be transferred to baby, as well as what mom's eating on a daily basis will also be transferred to baby. If a baby is born prematurely, as long as they have reached 26 weeks, they have a higher chance of survival. And one of the reasons for this is there's a very important protein in the lungs called surfactant, and surfactant helps keep the very small chambers in the lungs, the alveoli, I guess, how would I say this? Expanded so that they don't collapse on themselves. And it allows the lungs to respirate properly. And so before this time, babies have not had the chance to produce their own surfactant. And so babies born before this can have severe breathing problems and many complications. What is the goal of pregnancy? So the goal is to have a healthy and happy mommy and baby, and mommy to return to pre-pregnancy health or better. So we don't want moms to come out of pregnancy being nutrient depleted and or overweight and or with chronic conditions such as the development of diabetes or high blood pressure. As far as babies are concerned, one of our goals is to bring babies to term. And so anything over 37 weeks is considered term, and birth weight over 5.5 pounds is considered ideal. However, there are maximum ranges to this birth weight. Babies who are born after 37 weeks and weigh 5.5 pounds have higher chances of survival than babies born earlier or lighter. So birth weight. So baby is measured immediately after being born, literally before they'll even give baby to mom. And there's different indications for how baby relates to other babies, their age. Baby might be classified as low birth weight, and this would be a baby who is small, less than 5.5 pounds. Often these are preterm babies, and often they have to be sent to the NICU or the neonatal ICU, intensive care unit, because sometimes these babies are born so early they have difficulty breathing on their own, maintaining body temperature, or maintaining glucose levels, or they're kind of blue when they come out. And so lots of times these babies need extra support, and this actually is quite a large cost to the healthcare system. There's $4 billion spent per year on these small babies. They usually end up staying in the hospital longer. Babies who are small for gestational age are small compared to other babies their age. So what that means is if two babies are born at 38 weeks, both of those babies are term. One of those babies, say one baby weighs 3.5 pounds, the other baby weighs 6 pounds. That baby that weighs 3.5 pounds is going to be small for gestational age because he or she is small compared to other babies of the same gestational period. And again, these babies have similar complications to low birth weight babies. Excuse me. In the first trimester, some textbooks will differ, but this current textbook says no need for extra calories. And that's because the growth is very, very minimal during this first trimester. Baby still only might weigh a couple ounces at the end of this first trimester. And mom's uterus has not expanded that much, nor has the placenta grown very much at all. Second and third trimester, calorie range is 350 to 450 extra calories per day. What types of food should mom eat? Hopefully you're thinking healthy foods, whole grains, fruits, veggies, healthy low mercury fishes, nuts, legumes, dairy or dairy substitute, etc. And is she eating for two? Hopefully you said no. although she may be growing a little human, that human does not have such high calorie needs that it counts as an entire other person's diet. So mom needs to be careful and not pig out too much. Okay, so an example food plan during pregnancy. Mom might have 2,200 calories first trimester, add about 400 calories second and third trimester. And these are some of the foods that mom might eat. Specifically from each of these categories, I would say that calcium-rich foods, if it's dairy or dairy substitute, should be low fat, fat-free perhaps. 6 ounces protein, we would like that to be lean protein, potentially plant protein, or maybe a healthy fish with some good fats. 3 cups veggies, those veggies should have variety, meaning there's multiple different types of veggies, multiple colors of veggies, different seasonal veggies. Fruits, same thing, variety in color and type. And grains, most of those grains should be whole, and then veggie oil. So those would be some specific recommendations within each category that I think would be beneficial to both mom and baby. All right. Other things that happen during pregnancy. So pica. This is a picture of a woman eating dirt on a sponge. And another x-ray of somebody who has a spoon in their chest, which hopefully you would not have. It's actually in the stomach. But it can happen. Often during pregnancy, women get cravings for non-food items, and the prevalence of this kind of varies between woman to woman and even between cultural groups. There's a thought that the cravings are kind of developed due to some sort of unmet nutritional need, meaning potentially woman is deficient in one of the vitamins or nutrients or minerals, and her body is telling her to seek it out in her surroundings. And so eating of dirt, clay, chalk, ice, baby powder, starch, cardboard, paper, anything could be possible. You could imagine that this is not the healthiest habit. It can, severely interrupt digestion and absorption, can cause obstruction within the digestional tract, and is not nutrient dense and potentially could even be toxic. So women who are experiencing this should seek treatment. One resource for women is myplate.gov. So if you go into myplate.gov, you can specifically select that you are pregnant or even nursing, and there are specific dietary recommendations just for you because your recommendations are going to be different than somebody who is non-pregnant. What about vegetarian mommies? So lacto-vegetarians or lacto-ovo-vegetarians, mommies who are either going to be drinking milk or eating some dairy or having eggs in their diet, generally don't have too many issues, and that's because of the incorporation of some sort of an animal product. Strict vegans potentially can have many issues if their diets aren't well planned and or if they're not supplementing. And so specifically vitamin D can be low, B6 can be low, iron, calcium, zinc, and B12. Most vegan moms should be advised to, at the very least, take a B12 supplement, since this is not found in significant amounts in the majority of plant products. There are some, but unless mom is carefully planning and consuming her diet, it's likely she'll be low. Maternal weight gain. So I apologize that this table is slightly fuzzy to see, but goal maternal weight, meaning how much weight you should gain when you're pregnant, depends on what your starting weight is. So if you start underweight, you're actually going to need to gain a lot more. That's because you have to build up your own stores as well as build up stores of energy and fat that you can give to baby. Normal weight has a range of 25 to 35. Overweight and obese have lower ranges. And there is some literature that suggests, depending on the severity of obesity, obese women maybe won't need to gain any weight, but that is quite controversial. Oh, the fun times during pregnancy. So I actually wrote this lecture when I was pregnant, and it was about 2.5 years ago when I wrote this lecture. I have an almost 2-year-old. And so, unfortunately, I knew firsthand about some of these great things that can or will happen to you when pregnant. Heartburn. I had horrible heartburn. Never had heartburn in my entire life, but it hit me like a train wreck when I was pregnant. Um, Part of the reason is you have all of this extra pressure on your stomach because you now have the development of a baby and a giant uterus and a placenta in there. And that formation of the baby just really pushes your stomach kind of up into your body, as well as makes it slant more horizontally than how it normally lies, which is kind of vertically. And that horizontal position of it causes potentially some of the acid to splash up into the esophagus, or potentially causes that lower esophageal sphincter to not close properly or as tightly. Constipation. Constipation is very common, and so in order to reduce this, fiber, water, and exercise, those are similar interventions for hemorrhoids. Hemorrhoids actually happen when you have blood vessels that kind of expand and even prolapse out or move out of the bowel region, and they could even burst and cause bleeding. And this is due to excess strain during bowel movements. So fiber, water, exercise, prunes, anything like that can help alleviate these things. And I was surprised that some of these things affected me because I felt that I was eating very healthy and moving around, but the GI tract just can slow down during pregnancy. More fun times. Swelling. So the majority of women actually do get some swelling during pregnancy, and generally this happens in the ankles because of gravity. So at the end of the day, woman might be retaining some fluid, and that fluid generally moves to her ankles, but it can also happen in the fingers or the face or really anywhere on the body. Nausea and vomiting, very, very frequent, generally happens in the first trimester of pregnancy and then goes away, but in some instances it persists and can actually be quite severe, requiring hospitalization. They may refer to this as morning sickness. However, the term morning really has nothing to do with it. This can happen any time of day, any place, wherever, and it's definitely not isolated to the morning. Anemia. Anemia is going to be reduction in red blood cells or percentage of those in your blood. And this can happen because when you become pregnant, your blood volume increases, for example, your plasma volume, but the numbers of red blood cells don't increase proportionally, number one, and two, their increase is kind of slow compared to the plasma increase. And so you can have kind of this dilutional anemia going on. And this can potentially make women have some of the symptoms that are common in pregnancy, such as feeling more tired or just worn out or lower energy. More fun things that happen in pregnancy or could happen. Gestational diabetes is possible. So gestational diabetes is diabetes that develops during pregnancy that was not present before pregnancy. And generally speaking, this is due to hormonal shifts as well as shifts with insulin efficiency and sensitivity. Most women are screened for gestational diabetes at their first prenatal visit and then later around the second or third trimester. And this can affect about 4% of pregnancies. Moms with gestational diabetes need to be very careful to control their blood sugar because if they have high circulating blood sugar, more of that sugar goes to baby, and baby can actually grow very large, causing some birth trauma potentially and some later down the road lifetime consequences for baby. Women who have a family history of diabetes or obesity are at higher risk of this. Generally speaking, gestational diabetes will go away after birth, and so women are carefully followed up just to make sure this happens, but not in all cases. Okay, hypertension. So hypertension means high blood sugar, And gestational hypertension does not mean high blood sugar, it means high blood pressure. And gestational hypertension is high blood pressure that occurs after week 20 of pregnancy. It can lead, in the most severe cases, to something called eclampsia. And eclampsia in the mild stages could be edema, headache, visual disturbances. In the more severe cases can include convulsions, seizure, and even death. Because of the high blood pressure, it affects nutrient and oxygen delivery to baby. And so baby can potentially be being starved of nutrients. And so all efforts are made to try to reduce mom's blood pressure to a normal amount. Generally speaking, once mom delivers, this condition is cured, meaning she no longer has hypertension. Breastfeeding. So breastfeeding is fantastic and important. There are different recommendations depending on who you ask. According to the American Academy of Pediatrics and Academy of Nutrition and Dietetics, women should exclusively breastfeed for 6 months and then continue to breastfeed for up to a year while introducing complementary foods. And exclusive breastfeeding means only the breast. So no formula, no water, no food, nothing, just breast milk. According to WHO, or the World Health Organization, women should continue to breastfeed for at least 2 years. However, women are not following these recommendations to the extent that we would like them to. Only 70% initiate, only 30% continue for 4 months, and an even smaller amount of those, 20%, continue for 6 months. Despite the fact that not enough women are initiating and kind of riding the breastfeeding wave through their children's infancies, there are many, many benefits to breastfeeding. There are both benefits to baby and mom, as well as some of the ones listed here. Baby can have reduced food allergies. Baby might help improve speech development. Baby will have reduced or increased immunity due to maternal transfer of antibodies. Baby might have lower risk of diarrhea. For mom, there are so many benefits. I'm just going to name a couple, but she will recover from that birth faster. Some of the hormones released during breastfeeding actually help the uterus to contract and go back to its normal size. And this can increase her recovery, as well as reduce her bleeding after giving birth. Mom might have reduced risk of chronic diseases later in life, everything from hypertension to cardiovascular disease to diabetes to even reduction rates of cancer for the breasts and the ovaries. Mom may lose weight because breastfeeding actually does burn a lot of calories, and mom may have delayed ovulation, meaning she won't be ovulating immediately after giving birth, which reduces her chances of getting pregnant and allows her body to build back some of the nutrient stores that it had prior to pregnancy. Got milk. Okay, so how does this physiologically work? You can see a kind of cross-section of the breast. Within the breast, there are kind of these almost like grape-like clusters of cells, and they're called lobules. And the lobules will contract, sending the milk towards the nipple. The nipple actually has multiple holes, and the milk will come out of the nipple when baby suckles. Baby's suckling action causes these lobules to contract and also does kind of a vacuum motion to get the milk out. And baby suckle is based on supply and demand. So the more that baby feeds, the more milk that mom will produce. There is a hormone called prolactin that is involved in the synthesis of milk. And there are additional hormones such as oxytocin, which is produced during the breastfeeding process, which is very, very helpful to mom. How do you know if you're getting enough milk? So two good ways. You can look in the diapers. Is baby going pee? Baby should be having at least 5 wet diapers a day, maybe 6, maybe more. I remember the record of diapers that we went through one day for my son was 16 diapers. And I thought I was going to go bankrupt having him. But on a general day, it's closer to 5 or 6 diapers. Babies should also be having 1 or 2 stools a day. That's normal. And you want to monitor baby's weight. Generally, doctors will have you come back to their office within the first week of birth, within the first month of birth. I believe 2 months, 3 months, 4 months, 6 months, 9 months, and then yearly. So you can go have your baby weighed. Doctor will be monitoring growth charts, etc. I used to go to a breastfeeding class, and I liked the class. So I would go specifically for the breastfeeding part, but they also had an infant scale, and it was really fascinating to me and also reassuring to me that I could go there, weigh my baby, see that my baby was gaining weight, and know that I was doing a good job breastfeeding and that my baby was getting adequate nutrition. So that was helpful to me after my pregnancy. Human milk. So human milk is the best. Colostrum is the very first milk that mom produces, and colostrum is not produced in large amounts at all. It's produced in milliliter amounts, tiny, tiny bits. And it's literally this golden, rich golden color, and it's full of vitamin A. It's full of antibodies. It's very concentrated. They call it the liquid gold. And it's not very much, but it's really all baby needs, because if you think of baby coming out of the womb, baby has never eaten anything by mouth ever in their entire life. And baby has not even had any food in their stomach ever. So they just need this tiny, tiny little bit of milk. Usually colostrum kind of fades within about 2 to 4 days after giving birth. And what will happen is mom's milk will come in, they say. And this is where the milk actually changes as far as composition goes, and the milk becomes kind of more watery, less yellow, and just kind of a different substance altogether, as well as the volume of milk that mom produces greatly increases. Good things about milk: it is easy on the kidneys to digest. The protein load isn't too high. It has some of these essential fatty acids for baby's brain and eye health. The milk actually can change based on time of day, based on mom's condition, based on infant's condition, and even based on how long baby suckles. So the longer the baby suckles at the breast, the more fat content the milk will have in it. The milk will be thicker. They call that the hind milk, and that actually is supposed to help baby feel full and be satiated. Milk provides all the hydration baby needs, and so it's strongly discouraged to give baby anything else. You absolutely don't want to give baby cow's milk. You don't want to give baby water. Water can actually kill babies. You wouldn't think so, but water is not recommended for babies. Nutrient needs. So when mom is breastfeeding, her needs are different than prior to breastfeeding and when she was pregnant. She does not need as much iron and folate. She's not, making as much new DNA. She's not, having to prepare for a birth where she could lose significant iron. She's not having to give iron to the fetus that way. However, she still has increased needs for many vitamins and minerals as well as calories overall. Mom burns a significant amount of calories breastfeeding, potentially even more than she did when she was pregnant. So she might need to eat 400 to 500 extra calories a day. And even though she's eating this could still contribute to weight loss. Alcohol, caffeine, and garlic, what do we think? So alcohol should be avoided because it directly passes into the breast milk. Caffeine can be consumed in moderate amounts. Some women will report that their babies respond stronger to their milk after they've consumed caffeine versus not. Other women won't report any difference. Garlic or other kind of odorous foods. Some women will report that their babies are fussy after they eat certain foods, such as garlic or onions or beans or legumes or broccoli or even chocolate. And some babies won't be affected at all. So mom may want to and or need to change her diet slightly. And this is really hard for mom because mom's already been pregnant for 9.5 months, where she's had to change her diet significantly. And she thought when she had that baby, she was done with the dietary restrictions, but not necessarily. Mom should continue to drink lots of water and limit mercury exposure, so not eat any of those high mercury fishes or be around any potential environmental contaminants. More about breastfeeding. So there are some laws that protect moms who want to breastfeed. Thanks to President Obama, our ex-President Obama, he put into legislation some laws that would allow moms who are working to take a break for pumping and not be penalized for taking that break. He also wrote some legislation that allows all moms to get a free breast pump. So before, you either had to get a hospital grade breast pump prescribed to you if you were diagnosed as medically needing one, and or you would have to buy your own breast pump or rent a breast pump, and breast pumps could be up to $400. But now women, after I believe the 28th week of pregnancy, could just call up their insurance and get a breast pump. I did. They sent me a breast pump. It was like a $500 breast pump, and it's worked great. And I can take that breast pump to work and pump when I'm working and not able to feed my baby in person. When might mom's milk not be enough? There are quite a few situations, but for specific nutrients, we're definitely concerned. Breast milk is not very high in vitamin D, and so babies should be supplemented with vitamin D. You can get little drops that can be placed in the bottle or on the nipple itself. If baby is preterm or low birth weight, they may need iron. After 6 months, their dentist might recommend fluoride. And if mom is vegan, you definitely would like B12. Barriers to breastfeeding. There are so many barriers to breastfeeding. It is not easy for many moms, but I will tell you it is worth it if you ever plan to be a mom or are married to somebody who's a mom or have a sister who's a mom or an aunt who's a mom. Anything like that. Encourage them, be supportive. So some of the barriers include lack of support, lack of education, embarrassment, sore nipples, lack of milk supply or perceived low milk supply, having to go back to work immediately, or potentially infant issues like infant won't latch or infant is colicky, or infant isn't gaining weight. Those could be some potential issues. There are also cultural issues. Potentially mom's family has never breastfed, and so they're not very supportive or understanding of her in this process. Okay, so slightly different topic, avoiding birth defects. I did not talk about this a lot, but when we did talk about folate, we mentioned neural tube defects. And specifically, those happen between the 21st and I believe the 21st, maybe the 24th, but around days between the third and fourth week of pregnancy. And so having adequate folate prenatally is very, very important because many women don't even find out they're pregnant until after they have been pregnant for 3 to 4 weeks. In conclusion, you should know which nutrients are needed for pregnancy, benefits for breastfeeding, how long is recommended, weight gain for pregnancy, and some of the other interesting things we reviewed today. So I hope you enjoyed this lecture, and maybe it's some practical information you can apply to yourself if you are a mom or thinking of being a mom in the future, or maybe you can apply it to a loved one you know, a partner, a sister, an aunt, a girlfriend, whatever. So thank you for listening.